As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, US versus China, where I'll take you behind the scenes in the tumultuous US-China relationship. Find Face Off wherever you get your podcasts.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hello, Jess.
All right. So today we are going to talk about chronic cough. The clock is ticking, so let's get to it. All right, Dina, I kind of feel like it seems like everyone has this cough that's been lasting months on end. I know I had one. It's been driving me crazy. So let's talk about it. So, Dina, what is a chronic cough?
Yeah, so a lot of people are coming in still with chronic coughs that are lasting forever. So people cough to maintain respiratory health and enhance mucociliary clearance. So calls about kids coughing is by far one of the most common calls we get in pediatrics and can be quite distressing for kids. It can interfere with sleep, eating, and school. And chronic cough is defined as a daily cough that lasts 4 or more weeks.
So how do you, as a pediatrician, evaluate cough?
So as always, we always start with a thorough history and physical exam. So as part of the history, to help us understand how to best treat the cough, we're going to want to know things like how long the cough is going on for, if the cough is wet, productive, dry, barking, is coming in spurts just at night or all day long. We also going to want to know if you feel like you are wheezing, short of breath, if you have chest pain, and what current or past medication your child has been on for the cough, and if she has a history of asthma, pneumonia, or bronchitis or bronchiolitis. Finally, we are going to want to know if your child is around smokers or secondhand smoke. And now for the physical exam, we're going to look at if your child is growing well, if they have a fever, how fast they're breathing, and sometimes take a pulse ox, which tells us your oxygen levels. We're going to then look at their ears, nose, and throat to determine if there are any lymph nodes present. The pediatrician will also, of course, listen to the heart to make sure there are not any abnormal sounds. And then, of course, listen to the lungs to see if they're having any signs of trouble breathing, like breathing too quickly or retracting, which is when kids are having trouble breathing and they suck in the muscles on their chest to help them breathe better. And we're going to make sure that the baby has no wheezing or sounds of rales, which are these crackly sounds, which are signs of pneumonia, or if there's any sounds of bronchiolitis.
All right. So are there any tests that may be done?
Yeah. So sometimes we may do blood work to determine if there are any signs of infection, or send you for a chest x-ray to take a picture of the lungs and the heart to make sure there's no signs of pneumonia or fluid in the lungs or anything else going on.
What are common causes of a chronic cough?
So there's respiratory infections like whooping cough, and we're seeing an increase in, believe it or not, whooping cough in New York City right now. We've also seen cases of tuberculosis. We're definitely seeing still cases of RSV and COVID causing coughs. And there are some viruses that are more prolonged, which can cause coughs that persist. There's kids with asthma that cause chronic coughs. There's occasionally aspiration, bronchitis, pneumonia, and some other rarer pulmonary issues like bronchiectasis, ciliary dyskinesia, eosinophilic lung disease, or vascular lungs, or cancer that can also cause cancer. That also cause chronic coughs, which is definitely a mouthful. We also always think of other things for chronic cough that is not just from the lungs, such as heart issues, reflux, or as a process of elimination, when we can't find anything else, there's some kids that have just coughs that are just a tick.
All right. So what is there a treatment for chronic cough?
So after a thorough history and physical exam, we can usually identify the cause, which may require an antibiotic course, or if asthma, albuterol and steroids. If cough is dry, we can't find a cause for it. We often just observe it for, a few weeks, around 2 to 4 weeks, since it's usually caused by a virus and needs to just resolve on its own time. But if it's still persistent, your pediatrician may do a trial of asthma meds or reflux medication. And if the cough resolves, we'll discontinue the meds and after the trial, watch for the return of symptoms. If it worsens and new symptoms arise, then we might refer you to a pulmonologist or a lung specialist. If the cough is chronic, wet, or productive cough, your pediatrician may also give a trial of antibiotics for 2 weeks, like Augmentin to target common respiratory pathogens, for presumed diagnosis of chronic bronchitis, which is now in the recommendations, believe it or not. So if the cough is still persistent, then we consider things like a foreign body and then need for referral to a pulmonologist or bronchoscopy for a CAT scan.
All right. Well, Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.